We all remember, so meningococcemia or even severe sepsis can cause hemorrhage in the adrenals. And medication is a big part of it as well. We talked about etomidate can cause adrenal suppression, but also ketoconazole, and kind of anything that works on the cytochrome P450 mechanism that will decrease your basal cortisol production. And around the world, tuberculosis is the #1 infectious cause, but in the US, HIV. And for secondary adrenal insufficiency, we can guess what like the by and large the #1 cause is going to be. Yeah. So people who are oh my god, people who are on steroids long term and either abruptly stop or their metabolic demands go up, they're just not going to have the ACTH lying around or the cortisol to meet their demands. And then something else I thought interesting as a secondary cause is anyone who has head trauma or irradiation to the brain, it can actually show up like months to years later as a problem. All right, so our patient doesn't seem to just have some adrenal insufficiency, but he seems to be in an adrenal crisis. So this happens with increased stress. About 50% is usually from a GI illness, but it can be from other little viral illnesses. It can be just from like increased pain and even emotional stress. Patients can present in altered mental status and coma. They're going to have greatly decreased cortisol and aldosterone levels, so severe low blood pressure, low sodium, low glucose, and high potassium. And this is the #1 thing to think about when you see shock that's not responsive to fluids. And there's a very high risk of mortality. 50% of patients who have Addison's disease are going to have an adrenal crisis at some point in their life. So that's why having like a Metalert bracelet, or this person got some crazy tattoo, which I think is great. And then that led me to Google a bunch of other tattoos. I'm going to share with you. This is like the coolest tattoo I've ever seen. It's Lionel Richie, wears a Waldo costume, saying hello. Is it me you're looking for? And there's more tattoos. I just gotta go here. All right, so this is a great use of someone's arm hair to make a troll. This is a kid in like Norway or somewhere who got a McDonald's receipt tattooed on his arm. How silly is that? He's gonna regret that one day. This would be my tattoo if I were to get one on my arm. This is Jackie's tattoo. Water. And Bloomberg.
How'd you get that picture?
There's also one of like a cow, not like a butthole of a cow. You guys should Google like stupid tattoos. I swear it is at least entertaining. All right, so let's treat our crisis. We're gonna treat steroids. Rest in peace, China. I know. Too soon? I don't know. So our first line therapy is hydrocortisone. It has both glucocorticoid and intrinsic mineralocorticoid activity. In infants, 25 milligrams IV, about 2 to 12 years old, 50 milligrams, and adolescents is going to be adolescents and adults, 100 milligrams IV. Give it immediately if they have a known diagnosis of Addison's and they present a crisis. If you're considering that and they're in shock, that's not responsive to fluids. And then you're going to continue with stress dose steroids for at least the next 2 to 3 days, which is going to be whatever dose you gave them as a bolus. You're going to give that daily divided Q6 hours. Fludrocortisone is also a good steroid to use. It has a very strong mineralocorticoid activity, 125 times more potent aldosterone effect than hydrocortisone. And I know we use dexamethasone a lot, but it has zero mineralocorticoid activity, so it's not going to be that useful in adrenal crisis. If they're not super sick and you're thinking about adrenal crisis or adrenal insufficiency and you want to do the ACTH stimulation test, you can start and give that, do your test, and it won't affect the test. But if they're really sick, and you should just give hydrocortisone and not wait for the test. I just quickly wanted to talk about hypernatremia because, right, this kid had a sodium of 129. That doesn't seem like this would cause such a dramatic presentation, such dramatic altered mental status or cerebral edema. But it's important to think about the rate of change that this probably happened. Usually, if their sodium is greater than 125, it's not going to have that much effect on their mental status or any symptoms. Not until you get less than 115 are you going to see that. But when it changes quickly, it can't happen. And so when there's any sort of seizure or altered mental status, you got to go for the big guns and treat with 3% saline to get the sodium back up quickly. Otherwise, you should just treat with normal saline. And remember, we got to be careful about pontine demyelinosis. In general, you don't want to raise the sodium more than 10 milliequivalents in a day. But again, if they've been chronically hyponatremic, that's going to be more of a factor. If they suddenly go hyponatremic, suddenly bringing them back up isn't going to be, won't have the same consequences usually of demyelinosis. All right, so we'll wrap up going back to the case. The 12-year-old came in. He was treated with 3% saline. He got hydrocortisone. Over the next few days, he had a great response, resolution of cerebral edema. His mental status improved. He was extubated on the second day. Further testing showed he had a high ACTH and anti-adrenal cortex antibody, low aldosterone, giving him the diagnosis of Addison's disease. And then they couldn't actually find any sort of actual infection going on. His UA was normal. When they finally did tap him, his CSF looked normal. Blood cultures were all negative. So what might have happened is just a small viral stressor that could have happened that presented very dramatically in adrenal crisis. And he's going to go home on hydrocortisone and 9-alpha-fludrocortisone. And when these patients go home, they'll have to take this daily for the rest of their lives, but important to educate them about adrenal crisis. And they should have go home with an IM shot of hydrocortisone if needed for a crisis, and be educated on how to do that. All right, so just a quick summary. Always consider adrenal insufficiency or adrenal crisis for shock that's refractory to fluids or depressors. Very important to get a good medical history if they're on steroids. Important to know, as well as past medical history. Small infections or stressors can lead to death if you don't have good adrenal glands. Get steroids on board early. And just for cerebral edema, intubation, hypertonic saline, adequate sedation, and analgesia is important. That's my mom's dog Maggie, and she broke her leg. I don't have any children to show you. So.